Hi, see you again, Keith. You get to know me by now, I'm sure. Um, yeah, where we're up to. MRI. I was thinking, probably not. Oh, you have over with my finger. Probably not worth going over an MRI because everybody knows what it's like laying on the thing and going under in a big tunnel, loads of noise. The only thing worth mentioning was that I didn't realise is that he asked for a contrast scan. I'll probably explain that, but what they do is they put a cannula, in your vein, and they hook you up to an injection pump, bit like an American bloody death chair, death by injection, because you got these big needles and then big tube leading down to your sort of, your cannula in your arm. Itchy nose. And when they do the contrast right at the end of the procedure, and she comes on and says, we're now going to start the injection pump. And it hurt a bit, but, it ached more than hurt. But what it does is that it's, you can check up and find out anyway, but it's a chemical that exposes itself to the magnetic resonance of the MRI. And it obviously goes around your blood system. And what it's looking for is it's looking for high blood flow rate areas. So if you've got a growth in your prostate or anywhere in your body, it comes up red. And if the infection's moved into the lymph nodes, then those will show up red, or anywhere else. If it's in your intestines, your bowels or whatever. So I had the MRI. Excuse me. And I think I had the MRI on the Friday, I think it was. Following Wednesday, get a phone call. We need you in for a biopsy. And that was booked for the following Monday. So you can see that they're doing it pretty quick. So I thought, all right, okay, fair enough. I'd sort of researched it online. I knew what a biopsy entailed. Putting your feet in the stirrups, exposing your backside. So of course, didn't concern me. Bearing in mind, when I used to walk up, in the showers and, naked in front of all those men, not bothered. doesn't worry me one little bit. After all them years of doing it with Cocky Bennett and all the rest. Yeah, so, that's why I told you about what I did, because, no real concern. So this is where it starts to get a little bit more dramatic, because what I learnt, and there's the thing called the Gleason scale, which I'll explain a bit, probably all on its own because it's quite a topic, is that the only reason that you get called in for a biopsy is because the MRI has exposed the fact that you have a Gleason scale of 4 or 5, or a potential Gleason scale. They don't know for certain until they analyse the biopsies. And I was aware of this. So once I got the phone call to say we need you in for a biopsy, I knew straight away I've got cancer. Big C. Now bear in mind, it didn't faze me, because bear in mind, for the last 15 years, AF, what I was telling you earlier, that's why I told you. I'd conditioned myself already to that situation, or the potential. So I didn't know any more detail, obviously, other than the fact that I was being called in for a biopsy. So it was going to be significant. I think the term is the use on the Gleason scale. Because on the Gleason scale, one is you've got nothing. It's just BPH, which is benign prostate hyper something or other, which is basically just a swollen prostate as a result of age. And 2 is mostly nothing to worry about. 3 is, well, there's something there, but it's nothing major, nothing, and we'll just keep a watchful eye on it, I think is the term they use. And they do that by monitoring PSAs in your blood. But once it gets to a 4, then it's a significant, what the class is a significant cancer. And I'm explaining the Gleason scale now to you, Hannah. And the 5 is it's suspected to have moved out of into the sort of general body. Worst case scenario. And when you get a Gleason scale, you can have a Gleason scale up to 10, because what they do is that they look at sort of the cells around the general area, and you might have cells of 1, 2 or 3, but then there might be others in the sample that are showing signs of 4 and 5, more aggressive 5. So they tend to give you Gleason scales of maybe 7 or 8. And what they are is they'll say a Gleason 7 to 5, which means that, generally the cells around are normal, but you've got 5, which is, virile, significant cancer cells. But your urologist will explain this all to you anyway when you get your results. And, Google it. It explains it all there. And it's very technical, it's what they do medically. And this T2, Gleason 5, I don't know anyway. I'm not going to try and educate myself in all that. It's very, very technical. Too technical for me. Well, why bother learning it when they're going to tell you it? Yeah, so, biopsy. So, because you turn up and now you go to the urology investigation, I think they call it, or department, which is obviously where they're checking you. So I turned up fairly early in the morning at Truro. Oh, it's the city, and it's the only city in Cornwall, is Truro. I was trying to think the other day when I was talking to you. That's what it is. It's a city rather than a village or a town. Yeah, so anyway, I digress. So I turned up on the day, and of course there's some other guys there. Again, you're fetched in, you're given, blood pressure, thing on the finger, all the usual. They're just checking, making sure that you're healthy. And she tells me, oh, you're number 4. You're the 4th in this morning. So, okay, right. So, you know that you're going to be sat around for a few hours. But as I'm sort of sat there, there's these guys coming in, and I'm thinking, do you know that, are you aware that you've got a cancer? Because they're all just sat there, and some are sat with their wives and partners or whatever. So what they do is they have a nurse that then calls you in and gives you the verbal lowdown and asks you to sign the sheets or whatever. Oh, sorry, no, she didn't. It was the technical guy later that did that. And I'll mention her name just in case she's watching. It was Verity. Nice lady. And very efficient, very professional, very good at doing the job. She's obviously doing it all day long, every week. So I start asking questions like, do you know what the size of the abnormality is? And she says, no, it's not on the sheet. So she starts, she's going to take you through the procedure. So, I said, look, don't worry, I've clued up on it all, so I know what's going to happen. So she says, you've got a stage 5. Stage 5, obviously to me, immediately starts suggesting, it's out into the general area of your body. And it's a virulent, more virulent, or potentially more virulent, because you don't know until you get your lab results for the biopsy. Just because they say it's a stage 5, it could be like a stage 3-4 or 3-5 or whatever. And you don't know the location of it at that point. You haven't got the MRI scan results in front of you. And the best way I can explain it is that it depends on the size of your prostate. Most things will say the size of a walnut, but it could be like the size of a lime. It might be the shape of a lemon or an egg, So you've got to start thinking in terms of that sort of size. Sorry, my hand's wobbling. And so you could end up with like a marble-sized growth, or it might be pea-sized, or a grain of rice, or, So it's all those sort of things. Sat within that prostate. And I think I explained to you before that if that growth is too close to the margins or the wall of the prostate, it limits as to what they can do in terms of radiotherapy, or it leans them towards either radiotherapy or chemotherapy or whatever. So immediately you start thinking, it's stage 5, it's out into the area. So you then go back and sit down after she's done her bit and explained everything that she wants. Nothing really other than what I've just told you come out. So you sit down then and wait to be called in. You go then into a screened off, where they pull the curtain round. And she puts the gown over you. Well, you take your t-shirt off or whatever, your t-shirt. She puts the gown on and ties it at the back for you to keep your ass covered. And she tells you everything off. So you're naked. You sit there then 5 or 10 minutes, and this guy comes and asks if it's all right for him to come in, which I do, and it's the guy Tim. I'll not give you any other name just in case you're watching, Tim. Good job, well done. So he then sits down and I immediately say, look, don't worry, I understand what you're going to do roughly. I've briefed myself on it all, so save your breath. So all good, he's happy. So I said, how many biopsies are you going to do? And where are you going to do them? And he tells me they can do up to 30. He says, well, we're going to do 15 with you. He says, 3 in the area, the suspect area, the growth area. And then we're going to do 1 in your anterior, blah, blah, and then your posterior, 2 there, 3 there, 1 there. So I said, okay, I don't understand most of that, but, you've told me the main bit, you're doing 15. 3 in the suspect area. So, of course, when they're checking the rest of the prostate, that's where you get the 1, 2, 3 or whatever. And then when they check the actual growth, that's where you'll get the 4, 5, depending on what they find. So, of course, that's where you get the Gleason scale, 2, 5, 2, 4. You get a Gleason 6, Gleason 7, 8, 9, 10. 10 being the most, all your prostate is cancer-ridden. Right, so he gets you to sign the waiver, as usual, and he says, follow me. So, okay, I start to follow him. And I said, I just need to go for a pee first. So off I toddle, bare ass, with my gown on, because there's everybody, and the waiting room's almost full now. I'm thinking, bloody hell. So I have my pee, best I can, burning, stinging, toddle back. So they're all waiting for you to go in and to the electric chair, because it's a bit like old Sparky, You're thinking, bloody hell. Because you've got the stirrups there, that's where they're going to strap you down and put the wet sponge and turn the power on. So I mean, I'm chuckling away. And of course, they're all looking, thinking, "Oh, what's up with him? He's not fazed by this." And of course, I'm giving myself all these, sort of. You'd be all right if you got Cocky Bennett walking in here. Oh dear, you can imagine that all faces and go. You got to laugh, haven't you? So, anyway, of course, it's not facing me one little bit. So he says, sit down in the chair, put your feet in there, which I do, and of course, you're starting to get a little bit. And he's very good, is Tim, he keeps your sort of crown jewels covered, your meat and 2 veg, with your gown. But, it's not going to last long. So he starts to, ups the stirrups up a bit, get them a bit more elevated. And of course, you sat in the chair and it's not really comfortable, and then it leans back and it starts to get more comfortable. He says, ups your arse a bit further towards me. And of course, what they're doing is that they're moving the cheeks of your ass off the edge. Off the edge of the seat, so that they've got perfect access to your rectum. So I ups down, and then he starts to move your knees outwards, so that getting you into a bit of a stress position, really. And of course, by this time, he's very good, actually. He's sort of, I say, you're gonna tape my scrotum up to my belly. He says, well, in a way, he says, but we've got a thing that does that. So he rolls your sort of meat and 2 veg up in your gown, so he's handling your sort of your pride and glory, and then they have this sort of a sheet, like a one of those if you wet yourself, and it's got sticky tape on. So what they do is that they tape it sort of from thigh to thigh and underneath your scrotum, and then up onto your chest. And he says, just put your arms on the top of that sheet. So you're now coming up to 20 minutes. So I'm now going to stop here at the interesting bit, because I'm sort of, not cracking jokes, but sort of looking round at all these people, trying not to look at me asshole. So I've been thinking, 150 guys have been looking at that, years ago, for many years. So, don't worry, mate, I'd sooner get this over with and, get the results. But anyway, like, well, I don't know whether you like all this, but subscribe, hit the notification bell and comment, as I said before. I'm sure lots of you on through it. So I'll tell you about what happened next and on the next one. So